Hi, my name's Fiona and we've came from Glasgow, myself and my daughter, and we're really excited about getting our surgery done with Baris. I heard about him through a friend that used to work for him, and I've got another friend that also works in his surgery as well. Today's the day I'm getting my surgery on my eyes. I can't wait to see the results.
Good morning, everyone. As usual, I am just talking to you, announcing from the operating theater. So today we have a really lovely patient, comes from Scotland, and she actually contacted her with us like around 3 months ago, I think. This is what I have been informed anyway. So she wanted to have upper and lower eyelid aesthetic surgery, and we said okay, and we actually, my team has organized everything, and she came finally 2 days ago, and we finished her evaluation for surgery itself, and at the same time anesthesia. And then after 2 days she arrives, we started to do the operation, and I'm going to perform upper and lower blepharoplasty, and at the same time mid-face silicone thread lifting, actually, because when I do the lower eyelid aesthetic surgery, mid-face lifting is essential. This is what I believe, actually. That's why I almost always add mid-face lifting to do lower eyelid aesthetic surgery. So during surgery, I will talk to you something about this kind of things and tricks. Bye. Hello everyone, I have just finished the surgery. What I have done, as I said, I did upper eyelid and lower eyelid aesthetic surgery. It took 2 hours completely. I just told you about mid-face lifting with lower eyelid aesthetic surgery. I just want to describe it a little bit more here. So when we do the lower eyelid surgery, of course, we're going to cut a strip of skin which is excessive on your lower eyelid. And when we cut that skin, it's going to be having a risk that it's going to pull, it can be pulled down, that we call it extropion. Anyway, so This is not always a high risk, but it's depending exactly, firstly, to the technique and experience. So even you are so experienced, sometimes you want to avoid that complication and you avoid your scissor, and that's why you take a little bit strip of that. And sometimes it's not going to be enough for good result, and the patient will not be pleased about that. What I have described about this, I am doing as much as I want to take the strip. With what? With lifting and supporting the midface. Why? Because the midface is connected to the lower eyelid, and all the weight of midface is going to pull the lower eyelid down. What I'm doing, I'm just lifting the midface, and the support and the pulling effect of the midface to the lower eyelid it's going to be eliminated with this thread lifting. And if you lift the midface, you can take as much as you can from the eyelid and from the lower eyelid, and the result will be, of course, really good, and the patient will be pleased. If the patient is pleased, of course the surgeon is pleased. So this is what I'm going to say about the lower eyelid aesthetic surgery for today. Don't forget to subscribe my channel, and please click the button to have any notification when we release any video. Take care, bye bye.
Hi, I'm Fiona, and this is my post-op check-up. I'm very happy with the results of the eyelift surgery and the threads in my cheeks. I came to Dr. Baris and the service was excellent, and they looked after us all the way through, and I would recommend them to anyone.